Thank you, Mr. Chairman. Since we last met, there was a tragic shooting at the El Paso VA.
You can stop the clock on this. Don't need to clock him on this. Go ahead.
And I just wanted to take a moment, and I know that I speak for you and for the committee in extending our condolences to the family of Dr. Fjordbach, who, following 9/11, left a lucrative practice, moved to El Paso to work at the VA and help treat our veterans who are returning from Afghanistan and in Iraq, including veterans who had served in previous wars, and from everything we know about him, exemplified the kind of service and commitment to excellence that we want to see more of in the VA. And I want to thank the Secretary for the leadership at the El Paso VA. Your interim director, Pete Dancy, is doing a remarkable job. And as tragic as this shooting and this murder was, I know that the El Paso VA is going to come back better and stronger than ever. And I'd also like to conclude this part of my time by thanking all of the employees, many of whom are veterans, the frontline staff, the doctors, the providers, the mental health experts, the volunteers who do a remarkable job in El Paso day in and day out under some very trying circumstances, especially following the shooting on January 6th. And I commit to you, Mr. Secretary, that we will do everything we can to support that staff, be there for them, and make them stronger than ever going forward.
Thank you. Your support means the world to me, and I know to them.
Mr. Chairman, I'd like to continue by developing on the theme that we're looking at today in terms of the VA's opportunities and competence when it comes to building major medical facilities and providing world-class care and outcomes for our veterans in a timely fashion. Again, despite what I think are the best efforts of a truly remarkable team at the El Paso VA, due to a number of factors from staffing to resources to leadership in some cases, we have not been able to deliver on that for the veterans. What I hear day in and day out from the veterans that I represent and serve is that when they can get in, they're treated like royalty and very infrequently have any complaints at all. The struggle, of course, has been getting into the VA in the first place, or having an appointment that is not canceled, or not having your records dropped or erased, or not feeling like you have been forgotten. One of the other factors that makes it difficult to deliver world-class care in El Paso and to better serve our veterans is the age and the state of the facility that we're in today. And you were kind enough, Mr. Secretary, to visit El Paso in July of last year. And after a tour of the facility, you confirmed that conclusion that we have reached now for a very long time in El Paso, that the facility we have is inadequate, insufficient, and unacceptable, and we can and must do better for our veterans and for those who serve them out of that facility. Further complicating things in El Paso is William Beaumont Army Medical Center is building a new $1.1 billion facility 9 miles away from its currently co-located position with the VA Health Clinic. We have what I would say is an opportunity right now to decide what we can do to improve the kind of facility, the delivery of care, and the access to that care in El Paso. There are a number of partners there who want to work with you and want to work with us, including Texas Tech, which has the Paul L. Foster School of Medicine, the first four-year medical school built anywhere along the U.S.-Mexico border. We have University Medical Center. We have Tenet and HCA hospitals. We have a community, though one of the poorest from income and property values, is one of the richest in service, that is willing to get behind this and make it a success. I want to follow up on your commitment to take El Paso from one of the worst performing to one of the best, and I want to help answer Dr. Rowe's question and the question that you agreed was a valid one, which is, should the VA be in the business of building these facilities? We certainly don't expect $1.1 billion to be spent in El Paso, Texas. We would gladly take it. We're not expecting it. What we will offer is that through these partnerships, through the commitment and funding from the local community, we can make a deal for the VA that would prevent you from building a brand new facility or a hospital that I think there are some serious questions about the competency of the VA to do just that. And instead, perhaps test or prove a different model in the delivery of health care. It would solve, I think, a lot of problems for VA nationally, while meeting the expectations that we should have in El Paso of having world-class care for each and every veteran. Now, we received a memo that was written by VHA under Secretary Clancy August 18th of last year that said within 60 days they would have a game plan for such a facility. I probably don't have to tell you that today, at least in our office, we do not have a copy of any such plan. And despite, I think, our polite but insistent demand that we see one and be a partner in that, we have yet to see anything. Current Secretary Bob McDonald, who also visited El Paso recently, and we want to thank him for that, that was following the shooting, have both expressed to me your commitment, but I need to see some follow-through. I need to be part of that process that you admitted often happens behind closed doors and doesn't involve members of Congress. I want to be your partner in this. I don't want to be your adversary. But after 2 years and documented failings, including by VHA and the OIG, we absolutely need something better, and we need to be part of it. So what I'm asking you today is, from all the lessons that we've learned from Aurora, from Florida, from other facilities, and from the opportunity that we have in El Paso, will you commit to working with us? Will you dedicate someone, even on a part-time basis, to working with this community to develop that plan? We will be your partner in implementing it.
Yes, we will. I think one of the things both Bob and I have emphasized in our months at the department is the need to build on the strategic partnerships we have had in our communities. And I think El Paso is a great example of that. As you and I discussed a couple of months back, we really don't have a way forward there. And we're not positioned for success in El Paso today, and we need to get ourselves positioned for success. And I think the circumstances on the ground you just outlined very ably could create an ideal opportunity for us to leverage on those local partnerships and do the right thing for veterans and be good stewards of taxpayer dollars.
Thank you, Mr. Secretary. And I'll conclude by saying that we will follow up this week to share what we have assembled and to gain from you what you have and the team has built. And then from there, I think we need to move very quickly to implement something.
I understand.
Thank you. Thank you, Mr. Chair.